Dr. William Starsiak. In this video, I want to talk to you about a very interesting phenomena that most people aren't aware of, even most doctors. And this is the fact that moment by moment, the skull is moving and changing shape, very much like it's breathing. I've personally run into people who are adamant that this would be an impossibility, that the skull in every adult completely fuses and that fusion presents any sort of motion. So there's a few bits of evidence I want to point out that are to the contrary of that statement. The first one is that an osteopath, Thomas Crow, out of East Orlando Hospital back in, I think it was 2010 or maybe even earlier in the 2000s, did an MRI study looking at skulls and had a living person going into the MRI machine and getting serial MRIs of the same slice of the skull. And then they analyzed the data looking at the basic question, does the skull change shape? And the answer was yes, it does change shape. Moment to moment, they could easily see that the skull was changing shape. It's not a tremendous amount of change, but it is a consistent and measurable amount of change. And anybody who's ever been involved with creating a disarticulated skull for anatomic study knows that you can separate skull bones in an adult who is deceased. If you clear away the other tissues and you take a skull, you can use very delicate instruments to pry those bones apart. Or you can even fill the skull with beans and soak it in water, and those beans will separate the skull bones at the sutures. So if those bones had fused, that wouldn't happen. They would crack and the sutures wouldn't retain their nice jigsaw puzzle appearance, but there would be sharp edges from the cracking through the skull. So these two both pretty well established that there retains motion in the skull. And the fact that you can separate the sutures suggests that you retain the ability to move. Because if you're not moving, things fuse. That's exactly what happens in severe diabetes. There's a phenomena called Charcot foot, where the nerves to the legs are damaged, proprioceptive information about where the foot is in space doesn't make it to the brain because those nerves are damaged. So the movement of the foot cannot be properly orchestrated. So there's abnormal motion occurs on kind of a micro motion level, and it leads to inflammation and damage and arthritis in the joints at a very rapid pace, and then those joints end up actually fusing. So there you have a foot, which of course it moves, and it's so easy to see that it moves, but if motion isn't present, then it will completely fuse. But that's just not what we see in the skull. We don't see complete fusion. Some of the sutures, some of the time, in some full-grown adults and elderly will fuse, but not all of the sutures, not all of the time. And this resistance to the idea of the skull moving is one of the biggest objections to the efficacy of osteopathy in the cranial field, which is building a greater and greater body of evidence to support its usage. Of course, anecdotally, any osteopath who has really dug into the principles and began applying them over time, anecdotally, we see that it makes a huge difference. When someone takes a hard hit to their head, there can be problems that people don't connect with the hit to their head. These problems can persist years out. Headaches are one of the most common things, but because of the connective tissue connections between the head and the sacrum, this is particularly the spinal dura that attaches in the head. It surrounds the brain, it surrounds the spinal cord, it attaches in the head and upper neck, and then down at the sacrum. You can restrict the head's motion, and that will put a pull down to the sacrum, and it can even be associated with back pain. Now, I said that these motions were really subtle, so a reasonable objection for someone could be that, well, hey, yeah, maybe the head moves, but there's no way we can feel it because this is a fraction of a millimeter. There was a study done out of France, though, that disproved this notion. They created a device that could be set to move a very small amount. We're talking about micrometers, all the way down to like 10 micrometers. To give you an idea of how big a micrometer is, a sheet of paper is around 40 micrometers. A piece of hair is a little bit more than that, maybe around 70 micrometers. There's some variation. But people, untrained people, could reliably feel down to 15 micrometers of motion. And the motion in the head is logs above that. On the lower end, it's around 40. On the upper end, it's a little bit over 100 micrometers. So our threshold of sensitivity in our hands is more than good enough to be able to palpate that motion. So if this interests you at all, or you have any more questions about this phenomena, leave a comment below. You can also check out my website. I have on my drop-down menu, there is a title called Cranial Osteopathy, or What is Cranial Osteopathy? And in there I present some of the links to the studies that back up what I'm saying. So that would be a good thing to check out as well. Thanks for taking the time to watch one of my videos, and please subscribe, hit the like button, and check out my other videos.